Hey everyone, welcome back to my channel. Before we do anything, make sure you like, subscribe, and turn on your notifications, and let's get right into the video. Today is Monday, so it's Manic Monday, and today we're going to be talking about medication. We're going to be talking about the good things, the bad things, and the alternative, which is self-medication. Medication has a lot of positives and negatives, which we'll be discussing today in this video. There's good things, there's bad things, just like there is with any other thing. And there's also self-medication, which we'll be talking about a little bit later on. So we're going to break everything down one by one and get right into the discussion. So as you may or may not know by now, I have bipolar disorder, and the main medication prescribed for treating bipolar disorder are mood stabilizers. Mood stabilizers are defined as medications that prevent highs such as mania and lows such as depression. They keep your moods from interfering with your everyday life. Some examples of mood stabilizers include Abilify, lithium, risperidone, and Saffris. Now your doctor will tell you to take these mood stabilizers for about 2 weeks before you see a difference. You have to take them once or twice a day for 2 weeks before they get into your system, and then you should see a change in your behavior. Finding the right medication for you, finding the right mood stabilizer for you can be the difference between night and day, especially for people who have a hard time functioning with their mood swings, who have like really high highs, really low lows, or who may cycle through their cycles really quickly. Mood stabilizers are really good. Personally, I have been on all the aforementioned medications. So I've been on Abilify, I've been on lithium, I've been on risperidone, I've been on Saffris. And Abilify is the only one that has truly been able to help me. Like lithium, I had a lot of adverse side effects. Risperidone, I had a lot of adverse side effects. Saffris is a pill that you like stick on your tongue and it dissolves in your mouth. And the taste is so unbearable that I couldn't even tell you if it worked or not, because I just couldn't take it. And so now I was previously on Abilify, and now I'm currently on Abilify now, and I like it because it helps me stay balanced and it helps me to maintain a positive attitude without experiencing mania. So that's why I like Abilify. Abilify is a very good medication for me. Now let's get into some of the bad things about taking medication. So the first bad thing for me about medication is that finding the right one for you can be a very long and hard process. And the wrong medications can have adverse side effects. Like for example, antidepressants, if it's not the right one for you, they may actually cause you to be depressed. And mood stabilizers, if they're not the right one for you, may cause you to be unbalanced, for example, and have hallucinations. So it is a very long, hard road finding the right medication for you. It is very unlikely that you will find the right one the first time the doctor prescribes you something. It's very unlikely that will be the perfect one for you. It may not be bad. It may be helpful. But the first time, the doctor prescribes something for you, they don't know you. They're just getting to know you. You have to test it out. You have to try it out. You have to see what works for you, what doesn't work for you. So the bad thing about taking medication is that it's a very, very long process. It can take years before you find the right medication. You can find the right medication and then be taken off of it. And then it may be a fight to try to get back onto it. Just the whole process of just finding the perfect balance of medication for you is just a really long and just arduous process, and a lot of people don't want to go through it, and a lot of people end up giving up on it. Another downside about taking medication is that your insurance may not cover your medication. So your insurance may not be covered by your insurance provider, meaning if you need a certain medication, you will either have to switch insurances or pay out of pocket for it. So if you have to switch insurances, some of the consequences from that may be you may lose coverage in certain areas that you may have, been covered before. Now you have to switch just because you need this medication. And the alternative is paying out of pocket. So, and paying out of pocket, medications are very, very expensive. Pharmaceuticals are very expensive. Like for instance, I take Abilify, and the average price for a 30-day supply of generic Abilify is $689. So imagine paying $689 a month for a medication that you need to function. Like that's a very, very big downside to taking medication is when your insurance does not cover it and you need it. You need it to stabilize your mood. You need it to help you function in everyday life. You need it to help you stop from having delusions and being delusional. You are going to have to pay for this medication out of your pocket. And $700 is a lot of money to pay out of your pocket for medication. So, or you can switch insurances, like I was saying previously. But like I said, you may lose coverage in certain areas. You may lose vision or you may lose dental coverage because you need to pay for this medication. So that's a major downside of taking medication. Another downside about taking medication is the money. And what I mean by the money is everyone from doctors to insurance companies make money off the sale of pharmaceutical drugs. So doctors, hospitals, insurance companies, sales reps all make money. They all get a percentage when they endorse and prescribe medication. So the doctors get a cut, the sales reps get a cut, the insurance companies get a cut, but the pharmaceutical companies get the largest cut. So as I said before, Abilify is $700. That's a lot of money just off a 30-day supply of one medication. So everyone makes money off of the sale of pharmaceuticals, and that's not a very good thing because the result of that is that people are both generally overly and improperly medicated. So doctors are prescribing medications that they may or may not be aware of, that they may or may not have come in contact with before because they're new, and a sales rep may be pushing them like, oh, prescribe this medication, it does this, this, and that. And new medications haven't really been tested too often. So there may be side effects from trying new medications. People may be over-medicated. People may be under-medicated because the medications that they are on and are currently prescribed are just not working. So the result of the money making from the pharmaceutical company is that people are overly and improperly medicated, which I think is very bad. The last thing we're going to talk about is self-medication. Now, people tend to self-medicate when they are usually not on pharmaceutical drugs. Self-medication is using alcohol, illicit drugs, or risky behaviors such as engaging in sexual behaviors with maybe strangers in order to soothe something inside of yourselves. Now, a lot of people, like I said, self-medicate when they're either not prescribed their medication or when they're not taking the medication that they're prescribed. So that's when self-medication tends to come into play a lot of times. Now, people can self-medicate, like I said, with sex, with alcohol, with other illegal, illicit drugs. And this can lead to a lot of bad decision making and choices that have regrettable consequences. So you really just want to stay away from self-medicating in general because it's not good. And self-medicating can be very dangerous. Like you can end up doing something that you will regret. You can end up doing something that will end up getting you hurt or even worse, killed. So self-medication isn't really that good for people to do. It's better to take, if you're going to take anything, take the prescription drugs that your doctor prescribes to you. That is the best advice I can give about self-medication. As for myself, currently I practice self-medication and I take my pharmaceuticals. So I'm prescribed Ambien and Abilify, and I take them both at night. I think they help me to stabilize my mood and they help me to get the sleep that I usually need. They keep me level, they keep me positive, and they just help me, my medications, my pharmaceuticals. Now, I also self-medicate with marijuana. I smoke marijuana here and there just for fun, to lighten the mood, to pick me up, to get the giggles. I like smoking weed. Now, my psychiatrist and my therapist are both aware that I do smoke marijuana, and they are not against it. They say as long as I smoke it in moderation and I'm not doing it to self-medicate, to feel like I need to smoke, then that's perfectly fine. I smoke weed because it helps me relax. It helps me just to relax. Like I have a hard time relaxing and just letting go in general, and weed helps me do that. So like I said, as for me, I self-medicate with marijuana and I take my pharmaceutical medications. I also practice a lot of self-care, as I talked about in a previous video, with my oils and my crystals. So that is practicing self-care. That's not necessarily self-medication, but it is self-care. So I do a little bit of both. So all in all, I think it's important to find the right medication for you, to work with your doctor and find the right pharmaceutical drug that's going to work just for you and keep you balanced. And if you're going to self-medicate, try not to do anything that's going to cause harm or dangerous consequences. So I feel like it's okay to do a little bit of both as long as you're not hurting yourself in the process. Well, that's everything. Thank you for joining me for Manic Mondays, and stay tuned for my next video, which is going to be on Friday for Freestyle Fridays. And before this video ends, make sure you like, subscribe, and turn on notifications, and feel free to leave a comment down below. Bye.